that there are at least 47 different etiological conditions that can cause plantar heel pains? Imagine having a process that eliminates the 46 conditions that are not causing your patient's plantar heel pain. Hey, look, if you'd find that helpful, then welcome. You're in the right place. This video is for you. G'day, I'm Jedynak, international educator and health practitioner with over 30 years of clinical experience treating MSK conditions of the foot, ankle and lower limb. I help foot fixers, podiatrists, physios, chiros, osteopaths and other physical therapists take their skills and expertise to the next level so they can get the clinical breakthroughs their plantar heel pain patients expect. This third blog in a series of 8 is all about shortcutting your path through the conflicting research, complex issues and unpredictability that surrounds plantar heel pains. I'll take you through step by step the quagmire that surrounds this tricky condition to save you a heap of headaches. So if you're interested in getting more predictable results for your plantar heel pain patients, then stay tuned, because by the end of this blog, you'll be one crucial step closer to diagnosing plantar heel pains with ease. We know that plantar heel pain is the #1 MSK condition of the lower limb and the #1 source of biomechanical frustrations for us foot fixers. So it's vital that we accurately and confidently assess, diagnose and treat plantar heel pains. But where do you find the battle-tested diagnosis process for plantar heel pains? How do you navigate the barrage of plantar heel pain research that's coming at you everywhere you turn? Conferences, journals, online forums? Look, no doubt each of these sources have their merits, but as clinicians, we face the significant task of having to sort through the wheat from the chaff. Heck, the advent of Dr. Google means not only do you have to be on top of the latest evidence base, you also need to be aware of the crap that your patients might be coming in with, convinced that they've discovered the cure for their sex life as well as for their plantar heel pains. I understand the frustrations that surround plantar heel pains. Getting unpredictable results was a major headache for me and my patients. I was taught at university that the holy grail of biomechanics was root theory. I thought plantar fasciitis was a tensile traction injury caused by pes planus and excessive pronation. I also thought that the earth was flat, but that's a story for another day. As I discussed in my last blog, this latest evidence tells us that it just isn't the case. It's not the plantar fascia or the calcaneal spur that causes the problem. The plantar fascia is almost completely avascular and there's no histological evidence to support the notion of the plantar fascia getting inflamed. Anyway, if you haven't already, watch that blog before this one and get the crucial lowdown about plantar fascia thickness. It's a game changer. Okay, when it comes to plantar heel pains, one of the key reasons for unpredictable treatment outcomes comes down to nailing the diagnosis accurately. Given the massive number of potential causes of plantar heel pains, 47 at the last count, you've got to get the diagnosis right so that your treatment intervention is addressing the right etiology. Make sense? For sure. You know, I just received this message last week from David Ponsonby, who is a contributor to Steve Subotnick's Sports Medicine of the Lower Extremity. He said, 47 conditions causing plantar heel pain? We've written book chapters which might include maybe 3. The book was published in 1999, so it just goes to show the challenges that we face as clinicians. As promised, this series of videos will reveal the best practice protocols that have made assessing, diagnosing and treating plantar heel pains easier so that you're equipped to get the breakthroughs you need for your plantar heel pain patients. Today's blog will show you how to effectively differentiate the 47 conditions that can cause plantar heel pains. This is an incredibly important part of your plantar heel pain assessment. So let me break down the categories of plantar heel pain etiologies for you, and then you'll see where the 47 conditions fit in. Firstly, you need to know the 3 broad categories of plantar heel pain causes, which are mechanical tissue stress, metabolic or systemic conditions, and neurological conditions. And then you need to appreciate that plantar heel pains are generally multifactorial conditions, which means you're likely to have several elements from one or more of these 3 categories. Crikey, how do you survive this minefield? Okay, let's take a deep breath, steady our nerves, hold hands, sing kumbaya, and look at the first category, mechanical tissue stress. This category has 2 subcategories, which are skeletal etiologies and soft tissue etiologies. Under the heading of skeletal etiologies, the list of conditions that can cause plantar heel pains are acute calcaneal fracture, calcaneal fasciitis, calcaneal stress fracture, calcaneal tumour and systemic arthritis. Under the heading of soft tissue etiologies, there are Achilles tendonitis, heel contusions, plantar pad atrophy, plantar fascia rupture, post-tibial tendonitis, retrocalcaneal bursitis, enthesopathy, tumours. The next category of metabolic or systemic conditions causing plantar heel pains has 4 subcategories: systemic diseases, metabolic disorders, benign neoplastic conditions, and malignant neoplastic conditions. Under each of these subcategories, we have these conditions. For systemic disorders, there are 9 conditions. For metabolic disorders, there are 3 conditions. The benign neoplastic category has 5 conditions, and the malignant neoplastic category has 4 conditions. And the third category of neurological disorders that can cause plantar heel pains has 4 conditions, which are Baxter's nerve entrapment, medial calcaneal nerve entrapment, tarsal tunnel syndrome, and S1 radiculopathy. Phew! Have you taken your temperature? Checked your pulse? How are your vitals? Brilliant that you're still with me. Bravo, or brava. Add them all up, and how many conditions do you need to differentiate the cause of your patient's plantar heel pains? Yep, 47. Would it serve you to have a checklist of all these clinical differentials so you can refer to it rather than having to try and remember all of these conditions? I know it's served me and the practitioners I've trained, so I reckon you too would benefit from this checklist. And that's why we've created the dramatically valuable Plantar Heel Pain Differential Diagnosis Checklist. It's our free gift to you and your plantar heel pain patients. Just click the link on this page and get your copy. Print it off, have it in your consulting room for a ready reference to help you drill down to the true cause of your patient's plantar heel pains. With an accurate diagnosis, the chances of you resolving your patient's plantar heel pains dramatically escalate. In next week's blog, I'll clarify the #1 treatment trial to perform that'll help you determine if orthotic therapy will help your patient's plantar heel pains. Uses a third of the tape, takes a third of the time than the typical low dye strapping techniques. Thanks for watching this video, and thanks for your interest in getting more predictable outcomes for plantar heel pains. It's truly inspiring to be with health practitioners who make it their mission to get the breakthroughs that help more people like never before. Join me next week for more battle-tested plantar heel pain shortcuts. Ciao.